Thank you so much for joining our panel today, The Impact of COVID-19 on Interpersonal Violence. I'm Samantha Alanis, and I'm the Strategic Operations Director for the Center for Health Equity Transformation, and I'll be moderating today's discussion. Oh, should we start recording?
We're recording, yes.
Okay, great. COVID-19 and the related stay-at-home orders have created and worsened existing stressors in many people's lives. And these extraordinary circumstances are correlated with increasingly hostile home environments. Approximately 1 in 4 women experienced interpersonal violence, and those numbers may have increased during COVID. Parents who feel stuck living with abusive partners during COVID may hesitate to ask for help because they worry no one will believe them, or they financially depend on their abuser. Additionally, youth do not interface with mandated reporters in school while they're attending virtually, and parents may also harbor fears of losing their children when police or the Department of Children and Family Services become aware of occurring abuse. Incidences of interpersonal violence have always been underreported, but people are facing additional barriers to reporting and seeking help during this pandemic. In this conversation, we will explore those complicated dynamics and discuss potential policy solutions for identifying and addressing interpersonal violence during the COVID-19 era. This courageous conversation is inspired by our center's work with the organizations participating on the panel today, who are members of our steering committee for Project Safe Space Chicago, which is supported by the Northwestern Memorial Foundation. Project Safe Space aims to develop and implement innovative solutions to help healthcare providers better support and respond to patients who may be experiencing intimate partner violence, especially during the COVID-19 pandemic. We're honored to have our panelists today, which include Anakami Barrera, the Manager of Advocacy and Crisis Intervention, Sexual Violence Support Services at YWCA Metropolitan Chicago, Nousa Gaitan, Senior VP of Programs at Mujeres Latinas en Acción, Maria Elena Leon, Counselor and Advocate of the Hospital Crisis Intervention Project at Northwestern Hospital, and that's from Connections for Abused Women and Their Children, CAWC, and Radhika Sharma Gordon, Education and Outreach Manager at Apnagar Inc. Without further ado, let's dive right into our discussion. And I'll say to all of the panelists, there will be some questions I direct to you specifically, but otherwise feel free to just answer whenever you feel that you want to respond to a question or you want to follow up on somebody else's answer. So this one is to the entire panel, so whoever wants to answer. How would you define interpersonal violence and what forms might it take?
I can take this one. I think interpersonal violence is the intentional use of physical force or power against another person. It can be physical, emotional, sexual, deprivation, or neglect. And interpersonal violence can occur in the community, in interaction with individuals, and they may not be related with the family ties, but they know each other or may not. They might be strangers, like we see sexual assault with acquaintance or stranger rape. It can happen in the workplace. It can happen in the schools, prisons, and many places. And there is a difference within what is family violence or domestic violence that is occurs within a family, and it may involve children abuse, elderly abuse, or in a relationship with intimate partners.
Thank you for that. And then I'll ask a follow-up question if anyone else would like to answer. Are there differences between interpersonal violence, intimate partner violence, and domestic violence? And if so, could you elaborate?
I just would want to add in that especially in immigrant and refugee families, many family members will live together, many generations will live together. And so very often, we're not looking for just intimate partner violence. In culturally informed screenings when working with immigrants and refugees, or working with anybody who's primarily from a non-Western background, we also ask, is there anybody in the family who's hurting you? Because it could be the in-laws, it could be the family of your spouse, or it could be the adult spouse of your children, who are also committing the harm. And so in that regard, we are looking at, family violence, or, we talk about domestic violence in a very broad term, recognizing that the person committing the harm is not always just your spouse or partner, intimate partner.
Thank you, Radhika. And on that note, I think that even though I work in this space, I often struggle with knowing the right words to choose, and I know language matters. So from your perspective, and this is to anyone, but what language can we use to be respectful of the dignity and autonomy of people who are experiencing interpersonal violence or have experienced it? And just using the example of the word victim, it acknowledges that harm was caused to them, but could it risk disempowering individuals? And some people may not like the term survivor. So what are your thoughts on that?
Go ahead. So I think a lot of times, even how we, when we train and our staff and our volunteers, even in my personal life, one thing that I learned is to always reflect back the language that they're using. A lot of times they're giving you the language that how they see themselves. So to me, that's what's the most important thing, is like, I'm always trying to figure out how do they see themselves so that I can reflect that language back. Because you're right, depending on the language that we use, it has so many different connotations. I know for us, a lot of times when I'm doing presentations or when we're in this kind of a space, victim and survivor can be interchangeable, especially because if we're talking about laws, how they use words. If we're talking in a hospital setting, they have a way of, talking about, I like the word survivors, but I also understand that I'm always listening out for how they choose to describe themselves and then just reflect that back to them.
I am totally in agreement with your explanation. And in my experience, some people really claim the word victims to see as I'm someone that the harm has been committed to me, that they may be saying that I'm not guilty of it. I'm in the receiving end of it. Other people may fight with the word victim because it may be disempowering. It might be that they feel now that I became a survivor. Now I'm I took a journey for healing, and I'm in a more leadership position right now. And so survivor is a better word to describe me. I do think that also it depends of the tone. It's not just reflecting what they are choosing, but the tone that you're using the term victim to someone. And I think it is important for us to remember is that being a victim or a survivor does not define who they are, their entire self. It's just that something happened to them, some harm happened to them, but it's not their entire identity.
Thank you all for your input on that. And I will say in advance, if there's ever any language I even say in my questions to you, please feel free to correct me in my language choices. So the next question, I want to start to open it up to anyone who wants to answer. And then I'm going to drill down to some specifics that that will be directed to a specific panelist. But generally, psychological and emotional abuse is invisible, but it can be deadly and result in many adverse health outcomes. So what is the difference between psychological and emotional abuse, and what are some examples of each?
I think psychological and emotional abuse go hand in hand, right? We're taught that emotions are often driven by our thoughts and the way that we think. So emotional abuse, going off the power and control wheel, would be putting the victim down, calling her names, humiliating her. And then psychological abuse would be minimizing, denying, and blaming. That again goes hand in hand with the emotional abuse. One of the examples that I hear a lot, especially doing direct service, would be when the person with the abusive personality minimizes the assault or minimizes the violence against their significant other, family member, by saying things like, you're remembering it wrong, I never hit you, or I didn't say those things to you, you're just making things up, you're being dramatic, or things along those lines that I've seen, that I've heard in my direct practice with clients.
Thank you for that. And then Nosa, what can someone do if they suspect they are experiencing some of these invisible abuses, but they aren't sure? And how can we all learn to recognize abuse and abusers rather than blaming a problem on ourselves to explain it away?
Sure. We may see some signs that it could be that someone has been suffering abuse. Low self-esteem, even if the person used to be more confident, change in behavior, that being more withdrawn, be depressed, anxious, suicidal, talking about jealousy, of bad temper of the intimate partner, constantly need to report to the partner that many phone calls that they are receiving, or agreeing, going along with their partners, agreeing with anything. In terms of addressing that, I think it is important to name the behavior, to name what you are seeing, and offer some opportunity for the person to talk about you, with you. It may take more than one approach, but I think it is important not to blame, not to judge. It is important to listen, to validate that person, and to express that you care, you are concerned about their safety. It's about telling the person that they're not alone and there are some help. So I think these are some of the ways that we can approach that person.
Thank you. You actually answered my next question about how could we approach it in a sensitive way. And so the next question I have is, I want to start by asking it to Anakani specifically, but I welcome anyone to follow up if you like. So BIPOC individuals often face intersectional oppressions that span across their race, gender, and class. How has COVID-19 worsened interpersonal violence for BIPOC women and non-binary folks?
I mean, COVID just made everything worse. I mean, as we know, people were just stuck at home with their abusers. And we saw, especially last year, even though our numbers led to reach people at the hospital, because that's where we would see them a lot, would be at the point where after the assault happened, would be in the hospital. And just like how violent those attacks were, we saw a lot more children, a lot more like what we call interpersonal violence, a lot of stuff happening at home. And unfortunately, a lot of times people just don't have the resources, or they don't know. One of the things that we did at the Y was to, we started doing texting and chatting for the Chicago Rape Crisis Hotline. And that was one way that we were trying to reach more people, because it's a lot easier to text if your abuser's in the same household. I'm in a 1-bedroom with my boyfriend. It's tiny. It's tiny. You can hear everything. And so those are the kind of things that we were thinking. We're like, how do we reach more people, and how do we give them a way to reach us without putting themselves into more danger? Because a lot of times that's what we see. For our immigrant communities, I think language has always been a huge barrier. We try to be as, with the Spanish, I think in Chicago, for the most part, I think most of the agencies have bilingual people, but we really rely on other agencies like Abnagar, like Canwin. I'm talking about, like, I'm thinking of the north side. I'm in Uptown right now, where we have to refer people forward to get those like very specific language needs. We work with like the Chicago Hearing Society when we're speaking of people with disabilities. So there's a lot of resources. To me, it's more, the problem is connecting those resources to the populations that need them. Because there's a lot of people. We work with Howard Brown. One of the things that happened at Howard Brown is that they were able to pass legislation so survivors could get the kits done at a more friendly space in healthcare, especially for non-binary folk and for LGBTQT plus community. And so we've seen how agencies have really looked at these problems and see how we can break down these barriers for resources. I don't know if anyone wants to jump in.
Well, we also we experience a lot of people having difficulty in using technology by not having access or not knowing how to use it. The other thing is that there was a tremendous effect in children, because children were at home, and the school would be a place that they would feel safe. They would have food. They would have some level of support and free of violence, and staying at home, they were much more exposed. Parents could not prevent for children to witness the abuse that was occurring. I mean, like the whole thing of loss of privacy. I cannot, even if it's accessible to me, a phone call or be in a video conference with my therapist, I don't have the privacy to do it, right? So what we saw not just an increase in numbers, but in severity of cases. It's much more severe, the abuses that they were exposed. And I think it has to do with the economic security that they do not have, the inequalities, the experience that they have as a multi experiences of victimization. So this just, I think, and the negative interaction with systems, right? Many places were closed or became available just remotely. For instance, we were closed for in the beginning of the pandemic and only open to receive in-person walk-ins in the month of June of last year.
Thank you. And go ahead, Maria Elena.
And even to add to that, just experiencing in rural communities, it's really hard to have that outreach organizations like ours. There's a need for that, especially west side, south side of Chicago. When parents can't take days off of work to go all the way to downtown to get services or to even help their children, that's a whole day process. That's a whole day process, and it probably leads into multiple days that they have to miss work. So commuting all the way to the city just to get basic outreach, basic support is very difficult for the children, and to even disclose as a parent, because there's multiple barriers after that disclosure. And one of them is, how can I get that support if I have to jeopardize my job or jeopardize, my economic assistance or stuff like that related to that.
Thank you for adding that. And in a little bit, I'm going to ask you to elaborate some of the barriers facing children especially. But I want to add a question which I hadn't shared in advance, but a follow-up of what you all said. I'm glad you brought up the issue of economic security, because we know that Black and Brown people disproportionately hold low-income jobs that, like you said, they may not be able to take days off, that they had higher rates of unemployment due to COVID-19. And we also know that unemployment is a significant stressor that we often see correlated to increases in violence. And so what are some of the compounding factors that you think are feeding into that, and what can we do to address these problems that really stem in issues of systemic racism and racial inequality?
I think one of the things that we're experiencing is, amongst other things, for many Black and Brown, for many immigrant and refugee communities, the police don't have the same, aren't always the same resource that they are looked to within the dominant culture. And so there is a great deal of fear of police, a great deal of fear of outside resources, a lot of mistrust. There are so many institutions that have said one thing and then done something else that's greatly harmed individuals, whether it's the school system, the social service system, the legal system, the medical system. So there is a lot of mistrust and trust that has to be established. And so people are often relying on informal mechanisms. I will go to my parents' house when things really are getting bad, and I will go to my friend's house. And under COVID, those options were shut down. I don't want to expose my parents. I can't go to my friend's house now because, they're in, we're all in lockdown. So those informal mechanisms are also greatly decreased, that people were relying on, who don't want to go to any of the public institutions or any of the social service organizations. So that's compounded the problem and decreased the options for many, Black and Brown immigrant refugee communities.
I can share, we conduct a community assessment during the pandemic with over 500 people. And this is what we found. 68% of them had problems to pay their rent and mortgage. 57 report problems to pay utility bills. 49% reported issues with mental health. 49% report problems with medical costs to pay. And we know that our community in terms of disparity of getting very ill was very high in the Latino community, brown and black. And people would go to the emergency room only when they were very sick with very severe symptoms, right? They also said that in this assessment that we did that they had 69% had an impact in their employment. There was either loss of a job or reduction of the hours that they were work. 73% had an impact in their household income. And can you imagine with prices skyrocketing? So it was a tremendous impact on them. And 64% were not eligible for unemployment or for federal stimulus dollars. So the impact, it was even harder in our community or community of colors or immigrant community. So we had to move from counseling and therapy to do more case management. How can we unlock some money to help people with surviving mode?
Thank you. I see, Anakani, that you unmuted. Did you want to add to that?
I did. I'm just like messing with myself. Sorry. I have a touch screen. I was also going to add, we did see also a rise on the Chicago Rape Crisis Hotline. There was already a problem accessing mental health, and COVID just made that even worse. I mean, on top of, you know, all the economic struggle, if you already had underlying mental health issues, it got compounded. Especially we saw that a lot last year, like just people just feeling really isolated, a lot of calls of despair. And it was really, really hard. And I think notoriously, a lot of communities, especially, you know, speaking just of the Latino community, we don't like to do therapy. You know, I'm still trying to convince my mom that anxiety is a real thing. Like she's not buying what I'm selling. Like it's not happening. So like, when you put that on top, people are just stuck in their homes, isolated, they're with their abusers, or we have survivors that are still working through their trauma, and it just got compounded. It was astonishing. And then you can see how the impact of where, what as a community, larger like society, like how we don't, we made all those cuts in the city, remember years ago with the mental health services, you know, and they really never came back. And I that was one of the things that was really shocking and disturbing for me, was just the amount of people that were calling that were in real distress and didn't really have access to services, even, you know, with our own agencies of who we were letting in. I mean, slowly we're coming back now, but it's been a while. And also in the hospitals, not being able to, if they did show up at a hospital, not being able to be there in person, an advocate in person that was just there for them to make sure that they understand the process, and then later on help them connect to those services. It's huge. It's huge. And to tell you the truth, I'm so happy that we're getting back in there and that we're able to provide these services. Like it was just getting really, really bad.
Thank you for sharing that. And I relate to that personally, because I think I had my first anxiety attack when I was maybe 18 years old. But when I talked to doctors about it, I felt like they just dismissed me because they only paid attention to like the physical reaction. And because I wasn't having an anxiety attack in the doctor's visit, then, you know, they just ignored what it was. They didn't encourage me to seek help. And I'm Asian American, and I think we're kind of stereotyped to not have emotions. And so, you know, it's just unfortunately something that's often neglected in I think many communities. And related to some of the other things that you all have discussed, and I want to direct this to Radhika first, but what are some of the additional challenges that immigrant survivors of abuse face, and how has that also worsened during COVID?
Well, absolutely, a diminishing number of options available to them. We also are seeing that we're learning. I just finished doing a language advocacy training for people working with English language learners who are survivors of crimes, and there are so many people who could not even get into buildings because the COVID screening was only in English and maybe Spanish. They couldn't even answer the COVID screening to go into either a hospital or some other place, because so often if there is language interpretation, it's not until you're in like the clinical examining room, not even when you enter the clinic, or even now the building, where the COVID screening wasn't allowing people into the building unless they could complete the COVID screening. So, there are those very real issues. There's the lack of language interpretation, the lack of available interpretations of COVID information in various languages, or for those people who for whom there isn't much of a written language, and most of the communication is spoken, such as like in the Rohingya community. There was very little information for them because things are either in writing, if they are translated, and there's nothing that's recorded videos, things like that are much more accessible to people. Those things weren't available. There's also the very real fear of deportation that is keeping so many people from seeking services. They don't want to get onto any rosters, any public rosters of any kind, including COVID vaccine questionnaires, because they're so afraid that they'll end up on a list and end up being deported. And if their options now their diminished options now include the police, well, we know so often across the country, police have cooperated with ICE in deportation, in identifying people who are undocumented. And so even though Chicago is a sanctuary city, and city employees are not allowed to ask immigration status, there are still instances in which, police do cooperate with ICE or report to ICE, or, there's the fear that that will happen. So, people are very afraid to seek out resources. We're also seeing that there is this really unusual circumstance of immigrant and refugee communities that are getting multiple services. Now the service providers are zooming into their home, and these ESL instructors and workforce employment folks who are giving them services are suddenly getting a glimpse into their home life and are totally unprepared if they think they're seeing abusive situations. And so, that's incredibly difficult. And then we were hearing multiple stories of especially in the beginning of the pandemic, COVID, people sick with COVID in the hospital, not being able to speak English, and then sometimes being passed over because the provider couldn't immediately speak to them in a common language. And so totally being denied their human rights to equal access to services, because so many institutions are not equipped to provide live interpretation and translation. And so, those are just some of the many, many problems that we're seeing. And then in addition, when we've had to, in the beginning of the pandemic, shut down our shelter facility, the option was to put survivors who were having to escape for their safety, into Airbnb or long-term stay hotels that are equipped, with furniture and a kitchenette unit and all of that. Well, there are some really high need clients who were in need of a lot of support. And unlike the shelter facility, where they can come into our safe home and there's 24/7 staffing, and so often trauma survivors are, suffering from lack of sleep. They can come down at 3 a.m. and talk to the staff member, when they're in our shelter safe home. Well, that's not an option when they're isolated in, they're safe from the person who's harming them, and they're safe from exposure to COVID, staying in their individual hotel unit. But they're isolated and don't have access to the support that, clients, program participants who our agencies serve, usually before the pandemic, they could come to the offices and speak with us and get support. And that's not as much of an option now for so many of the clients we serve. We also are seeing that so many of the, Upnagar clients come from, more than 60 different countries. And so there's a diversity of languages and cuisine. A lot of our clients have had to leave their jobs because their children are at home, or they've been laid off because, of the economic downturn with the pandemic. And so they're relying on food assistance. And very often the food banks don't have a diverse food supply. And it's like, there's no dal, there's nothing to make fufu. There's nothing to make, even rice and cumin and things like that. It's like, well, we have mac and cheese and some, something here. And well, those food supplies are not the foods that many of them eat. And so for many, it's like, I couldn't keep my Muslim halal or my Hindu vegetarian diet with the donated foods, and have a healthy, diet that my kids will eat. And so those are just some of the many, many problems that immigrant and refugees are experiencing under the pandemic if they are experiencing gender-based violence.
Yeah, and I also I would like to add to that just a couple of my own cases. I work with immigrant survivors here in Chicago. Something that I've been seeing because of the pandemic, they had jobs that were paid in cash just to continue with the flow of economic assistance. Some of those jobs were, I'm thinking of one client in particular. She would babysit children, she would clean houses, and all of that was very limited because of the pandemic. So she did lose a lot of her economic assistance, cash assistance. And something that I've been realizing and noticing when we do apply for those resources, right? I'm thinking about like 311, like rental assistance resources. There are so many barriers for them to even get that assistance. And again, like Radhika said, the fear of even expressing their need or expressing what they're going through, because one, they might not have citizenship here, to just all of the threats that the abusive partner or abusive person would even instill in them. But something I am seeing is the lack of resources for immigrant people when it comes to economic assistance. Something I wanted to add.
Thank you both for answering that. And so the next question I have is actually for Maria Elena again. This is turning the direction a bit to talk about youth because they are also especially affected by this pandemic. So when the stay-at-home orders first went into effect, reports of child abuse and neglect plummeted, not because there were fewer cases, but because youth were not interfacing with mandated reporters in schools, such as teachers and social workers. So what are some additional barriers for children, parents, or others to report incidences of known or suspected child abuse and neglect? And what have been some of the strategies to improve access to reporting and support services during COVID-19?
With my client specifically, I'm thinking of right now, she has 5 children right now that attend public school. They have been trying to do more screenings and to check in on the parents, to do more assistance, whether it is meeting one-on-one with the parents to see how they're doing, provide some either economic assistance. That's something that's really big with this particular client. Emotional support and referrals. I think there has been an increase in that when it comes to one-on-one with parents and making sure they're okay. Something that I would love to see in the future probably would be starting at a young age, maybe in high school, talking about healthy and unhealthy relationships and what that looks like and the dynamics of domestic violence and IPV. That way children are more susceptible in disclosing any forms of domestic violence or anything that they're experiencing at home. I don't know if that works. That's something that I would love for it to happen. But again, it's really hard for rural communities to implement or to get those resources from different agencies. Something that I've done with my own clients with supporting or making a report is explaining in detail what the report looks like. Also providing emotional assistance and allowing the clients to also be on the call if they would like to add anything when it comes to making that report. I don't know if anyone else wants to add anything, but that's some of the ways that I'm dealing with providing more assistance to children.
I think that social media is super important, and especially if they don't have privacy in their homes, being able to text or being able to report on some sort of safe social media that they're being harmed, and to get information is so incredibly important now as well. So we're seeing some really innovative things that people have been doing across the world to allow for reporting on social media in a safe way. And God only knows, I know nothing about most of the social media that my 20-year-old is on, and so she's very safe to say all sorts of things and do all sorts of things that I'll never know about. But and I think that can be said for people from many different cultures, and that youth have access to a lot of social media that their parents don't, so they can safely communicate without their parents' knowledge if they're seeking support.
I think the I think the relationship, the partnering of TV providers and the school, it's key. And I noticed that not all schools would accept that partnership or allow you the time to have the contact with their students. So this is something that I really think it needs to be worked on, because then if you have access to children and youth, you would be able to increase the awareness and hopefully address the issues at the prevention level.
We also, oh, go ahead.
And even adding to that, just more training for faculty in the schools, training on screening for IPV or domestic violence, assistance, knowledge of resources that they can connect the parents, the children to, how to even talk to the survivor. In my own experience in high school, just that victim blaming or that component of you might be ruining this person's life if you say or if you pursue anything against this person. So possibly more training, support for faculty will help increase the awareness as well.
Such an incredible, such a very important point, Mariana, because I know that Upnagar and probably many of our agencies, people have reached out to us, and there are going to be trainings to prepare Chicago public school teachers for the return to in-person teaching. And one of those things that we've been asked to help with is to address the mental health issues and the trauma that children will be coming out of as they come back to school because of their prolonged exposure. We know all that exposure to seeing your mother or stepmother being abused is considered one of the major forms of an adverse childhood experience that has a trajectory that impacts adults and higher rates of chronic illness, infection, substance use, depression, et cetera, et cetera, et cetera. So young people, even if they weren't directly being abused, they were being traumatized by seeing the abuse in their homes. And so we know that, yes, we very much need to do things like, mental health first aid, that 8-hour training that trains non behavioral health specialists in understanding trauma and mental illness, etc. There are other trainings that I think are very important to help prepare adults to work with young people who have been traumatized. And we need this to go beyond not just the schools, but also any youth serving programs, whether it's after school programs that are run by nonprofits, whether it's youth congregations, et cetera, we need to have a broad base of training and information and resource linkage to help people who are in contact with troubled and traumatized youth, to refer them to the services. And then also what's really, really important is so many young people were dependent on schools for their food. And so many parents are not aware of the food aid being provided by the schools. And so I think that's another thing that we need to get the word out about for young people who are like, this is where I get most of my food, is the school. People aren't aware of the electronic, the card that's being now offered to the parents of CPS students, et cetera. And the assistance, the food bags that were being given out at schools. That's another really important thing that schools were providing for young people that were not available, or they didn't know that that food aid was available under the pandemic.
Thank you all. And I did drop a link in the chat because I know we said we'd talk about policies that people could support, and I wanted everyone who's attending to be aware of the Keeping Youth Safe and Healthy bill that's currently being proposed, and I think it might have even moved forward in the state legislature. But Maria Elena, you mentioned that you'd like to see information about healthy relationships taught in school, and this bill actually proposes to do that within mostly sex education, but just a wide array of topics that help youth make healthy decisions, recognize when they're in unhealthy situations, and how to move forward from there. And then this is a state bill, so the Chicago Public Schools actually have the Office of Student Protections. In case you can't tell, like, my area is more about like youth and children as opposed to IPV, but the CPS has the Office of Student Protections, and this actually came after the Betrayed expose a few years ago when there were a lot of incidences of child sexual abuse that were not being reported or followed through on. And so they have made some progress on that, but definitely COVID-19 has created more barriers, because if someone is showing signs of abuse in a virtual classroom, it's like they look down and disengaged. That's pretty much how everybody looks on Zoom right now. And so it's not easy to necessarily pick out or support somebody in that situation or know how to help them if they're experiencing abuse in their home, especially if it is from their caregiver, and then consulting with their caregiver may not be the right solution for them. And so I know that there are some additional questions that we want to ask about youth, but I'm going to first see if we can get to a few other questions, just given the amount of time we have, but this still ties into this. So this, I welcome anyone to answer, but and this is something that I especially care about a lot, because I just had a baby in August, so I spent half of this pandemic being pregnant and then the other half taking care of an infant. And I have been concerned the whole time about the potential for intergenerational trauma and how that would affect my baby. And I don't want to repeat any cycles. And so just a question to the whole panel, whoever wants to take it, but how can we address intergenerational cycles of abuse or neglect without stigmatizing the individuals who have experienced those things?
There's really, really beautiful trauma-informed work being done by a number of early childhood specialists. Dr. Alicia Lieberman out of the University of California, San Francisco, she's developed a model which I believe is the model that are being used in many of our domestic violence programs with children. The premise is that parents who are coming out of an abusive situation, if we focus on strengthening the parent-child bond and showing and pointing out to a parent how powerful and important they are in their children's lives, that has an incredibly healing, thriving effect on the child and the parent, and it helps them to normalize. We also know that working with children and their parents, the importance of social emotional learning, of being able to name your emotions and being able to do, get coaching in emotional regulation and finding appropriate ways to express, anger and pain, and to admit that, you need help, and to build on empathy and kindness, because, development of empathy and ability to regulate one's emotions are key to preventing perpetrating abuse in the future. So, those are just some of the immediate thoughts.
And I think we may think that this is going to be a result that, of course, we know that it's a learned behavior. Violence, being violence, it's a learned behavior. But we also need to believe in the resilience of a child, the ability of that child to have the natural ability or their genetic makeup, the interactions that they would have with other people, that it might be very positive, and they would break that pattern that it was kind of passing from generation to generation. So I think it's not just one thing, and it's that is going to be sure or detrimental because of my own experience. They may choose to be wonderful people, wonderful parents, and do not repeat the abuse or become victims themselves.
I think like breaking the cycle is huge, right? And we see this a lot when maybe a child reports because someone went into their school and they kind of get thrown into the system, and then you start speaking to the parents, and then it's just like, oh yeah, this also happened to me. We'll have cases I've seen at the YWCA where they came in for one child, and then they found out it was the granddad, and not only was it like all like the grandchildren, but then it was, oh, then the parents, like I think a lot of it is creating a safe space where the parents are in the course of getting services for their kids, they're like, oh yeah, this also happened to me. And we talked as a family, and guess what? All these people were abused by the same person. And we see this again in the hotline too. Someone will be calling for their kid or for someone they love, and in speaking with them, they disclose themselves about their own abuse. And a lot of times is, if we're not doing the blame game, if we're like a safe space, I feel a lot of times people are just like, they will disclose to you once they see, oh, how I've reacted to the one disclosure, then they're like, oh yeah, this also happened to me. And being able to offer services for the whole family, it's so crucial to saying, there's services for you too. This affects the whole family. And just making sure like those services are expanded to everyone is a crucial factor.
Thank you. I have like 100 follow-up questions, but for the interest of time, I will move on to the next question. And I'll start with Maria Elena. What are some creative ways for healthcare providers to support people who might be experiencing violence?
Something that we are looking into is possibly creating a confidential space for them to screen the survivor, whether it is being able to message the doctor let them know that they're going through something. Other ways that I've helped survivors within like Northwestern Hospital, just kind of helping the social workers screen for domestic violence. And one of the ways that we do that is by creating a plan. So for example, if a client or a survivor is coming into the hospital with that we know with the abuser, but we suspect IPV, what the social workers and I would do is come up with a plan where we can remove the survivor into a confidential space where we can do direct services, speak with her, provide her some emotional support, and as well as screen for domestic violence. Those are some ways that we help in our hospital crisis intervention program.
I think putting a poster in their office just that about domestic violence, an image that may encourage people to open up and talk about. Having a monitor where they are in the waiting room and see resources for domestic violence. Or even given, I know that I think the network did this and some time back, having like a lip balm with the hotline number where people can take it and then call later at a later time, and having the ability to connect right there with a domestic violence provider, because it might be that window at that moment that this person is ready, or the time that she can talk or he can talk in a privacy to a domestic violence counselor.
Yeah, I definitely agree as well. I think also normalizing and pushing for medical staff to continue to screen for domestic violence, and normalizing that is a question that we should be asking to everyone, to continue to provide services for the survivors of domestic violence, and make sure that they know they're not alone, and someone cares. Yeah.
And I also want to mention, like, one recurring issue we've discussed within Project Safe Space Chicago is how to address when healthcare providers are only seeing patients through telehealth visits and not sure who's on the other end of that video or phone call. And so there are some other recommendations that Futures Without Violence has put forward specifically, such as like having your virtual background listing a hotline number, or if you can text general resources to people that you are able to share them with everybody, or what are like the creative ways to provide universal education or a list of resources to everybody, as opposed to when you're not in a space where you can ask those questions and someone is not in the space to safely answer them. And so we are almost at time, and so I'm going to pass it to Araceli. We might be able to squeeze in one audience Q&A, and I know that I wish we could stick around for longer, but I do want to thank our panelists and then give Araceli an opportunity to ask a question and then close for us.
So I did see a lot of questions asking about specific resources. So I'll ask the panelists, like, if you have anything like that to share with me, and I can send that in a follow-up email. Let's see. This one is a little long, but how do we tell, this is from the Family Institute at Northwestern. How do we tell people who have been harmed about these potential interventions? So I know you guys brought up a lot of ideas, such as like if it's a telehealth visit, to include it in your screen, or having monitors with information or posters. But are there any ways to discuss these potential interventions, or resources with patients?
I think it's really important whether you are a healthcare institution, whether you are a housing program, whether you are a counseling office, what we're learning as a safe space project from the Futures Without Violence is to hand out like a short, just 4 or 5 numbers. Like we're seeing that a lot of families are experiencing, mental health issues, food, the need for food, the need for economic security, and then, family violence issues. Here are some numbers that we're sharing with everybody. So normalizing it, but making sure that the domestic violence number is hotline number is very easy to find, and letting people know if they don't speak English as their first language that the Illinois Domestic Violence Hotline has 24/7 interpretation available, phone interpretation available. So just let them know the language you need, and that an interpreter will come on. So there's those short, very short lists of resources. Every single one of us should be handing out those to anybody who comes to us for services. And yeah, we need to work with the Family Institute a lot more.
One thing that also works for us is that to use the model of a community health worker. People from the community that look like them, that can talk to their neighbor, that can talk to their, I don't know, people that they know, their family, about healthy relationship or unhealthy relationship, and about resources, and how they can know about the do's and don'ts to respond in terms of a disclosure. The other thing that works for us is putting flyers at the supermarkets, at the laundromats with a number, and very simple, like Fradika is saying. But I think we need to meet people where they are at, where they go. And those are some of the places that our population go, and it's a good way to outreach them.
Thank you both. I'll leave it to Samantha. I know there's a lot more that we could have covered. I'll let her close out.
Yes, I just want to thank our amazing panelists today, and thank you to our attendees. Please subscribe to our newsletter so you can learn about future events like these. And this is an issue that we all obviously care a lot about. And so we hope to see you at more events in the future, maybe one day in person again. And please take care and have a good weekend.